So, the big question is, what difference has CII CPAR made to me and to my patients? So I wanted to tell you a recent story. Around New Year's, I received an e-notification that a patient of mine had been discharged from emergency. And at the moment, depending which hospital they've been at, you sometimes don't get a lot of information. So all I knew was that he had been to emergency and he was discharged, and the diagnosis was an upper respiratory tract infection. And I went on Netcare, and it didn't have the emergency report yet. And there was no mention of any lab tests or chest x-rays or anything. So I had not much to go on, but he's elderly. So I gave him a call to see what the story was. And what he told me was that he went to emergency because his common law partner was in the hospital with a very serious case of COVID. And he was worried that he had COVID and he was having difficulty breathing. But when they checked him in emergency, he was his oxygen level was pretty good, and they felt that he could manage at home. So that allowed me to check later that day for his COVID test result, and sure enough, it was there and it was positive. So then that allowed me to activate the COVID pathway and go through with him and phone him every day because he was 77 years old and had hypertension and a couple other conditions. And I could check every day and see how he was doing, and had given him kind of red flags to watch for. But also, as it turned out, unfortunately, his common law wife died of COVID. So I was also able to provide emotional support. And I think that was very useful to him, especially because he was isolated with COVID. He couldn't have family members coming to see him and so on. So he looked forward to that phone call every day. So the bottom line is, I would not have known that he had gone to emergency unless he had contacted me himself, because I didn't get the emergency report for about another 10 days. And I wouldn't have gotten a copy of that COVID test result because it was done in emergency and didn't have my name on it. So that's just one story amongst many that myself and my colleagues can tell you about what a difference CII CPAR makes to our patients and to us.